Hello, everyone. My name is Dr. Robert Gatis, and welcome to another edition of my series of Facebook Lives that I call Dr. Gatis's Medical Musings, Dr. G's Medical Musings. So today our topic is, what type of Alzheimer's disease might you develop? At my tender age in my 60s, there are times during the day where we have what I would call senior moments. I'm sure we've all had them, no matter what age you are, where you walk into a room and you can't remember what the heck you walked in there for, or you're looking for your glasses, that I do practically every day. Anyway, back when we were studying Alzheimer's disease, and from what we know, diagnosing Alzheimer's is not that easy. There are many overlapping symptoms with other disease processes, and the forgetfulness and fuzzy-headedness and confusion and changes in personality or behavior, they can all be linked up to other diseases also, including other forms of dementia, stroke, lack of restorative sleep, hormonal changes, aging process itself, and reactions to certain medications. So we know, and you probably read in the popular press about the association with Alzheimer's and aluminum, the association with the development of amyloid plaques in the brain, and a particular protein called the tau protein. However, those are associations, they're not causation. In other words, these are there, but not necessarily the cause of the problem. In fact, we're beginning to understand how multifactorial Alzheimer's is. The pharmaceuticals took it upon themselves when they found out about the amyloid plaque idea to use or target drugs to see if they could eliminate the plaque and therefore eliminate the process. Well, they failed miserably. It's estimated that 99% of the drugs that have been developed so far do nothing to manage the disease or reverse it at all. Dr. What was his name? Leroy Hood. He's a scientist, PhD. He also said that Alzheimer's is really complex, and he said that because it's a complex disease, it'll never respond to just a single drug, and I think he's right. In the 2011 Lancet Neurology, they mentioned a whole bunch of different, quote, drivers that could be driving us towards Alzheimer's. And there's an extensive list, everything from chronic stress to low kidney function, inflammations, high blood pressure, and having the ApoE4 gene, which I'd like to have that done sometime. Might not be a bad idea. It increases your risk for Alzheimer's. That's the ApoE4 gene. So if a drug approach is not going to work, what does work? Well, there's a professor of neurology at UCLA, Dr. Dale Bredesen, who believes that Alzheimer's is triggered by a broad range of factors. He's identified, after nearly 30 years of research, a huge number. I think there was over 36 mechanisms that amplified the possibility of driving the disease, but these factors aren't enough by themselves to create the disease. They're a cumulative effect. And we're aware now that there's a balance between synapse creation and synapse destruction. It's like the yin and yang of the nervous system, where we have connections of neurons, and then we have to have destruction of neurons. Just like every cell of your body has been recycled. There's not one cell in your body that existed even 7 years ago. They've all been recycled. So Dr. Bredesen believes that these processes live in equilibrium, and we need a multifactorial approach to the problem. He also believes that there are 3 subtypes, and this is first thing I've heard of this, which brings up the question that we're posing today. What type of Alzheimer's disease might you get? What might you develop? So his first type of Alzheimer's is what he calls the basis of it is systemic inflammation. Now, most of us believe, and I'm one of them, that chronic inflammation rather than acute is the underpinning of most of our chronic diseases. In other words, unchecked inflammation creates problems. And it's a precursor to accelerated aging and more than likely Alzheimer's disease, because chronic inflammation has been linked to memory loss and cognitive decline. So I was thinking about this, and I thought, well, it stands to reason that we do check in the blood for certain markers of inflammation. So the ones that are the easiest to measure that might be useful to know in situations as we get older. One is the hsCRP, or the highly sensitive C-reactive protein. There's ferritin, which is basically the storage form of iron, and what's called the RDW, which is the red blood cell width. And apparently, if any of these markers are chronically raised in the blood, there may be a good chance that you have systemic inflammation and need to do something about it. In addition to the fact that it probably increases your chance of getting this subtype that Dr. Bredesen has identified. Subtype number 2 appears to be more related to handling blood sugar. This is why some people call Alzheimer's type 3 diabetes, etc., because it's linked up to insulin resistance. And it may also be linked up to unchecked oxidation, because he's linked it up to low levels of certain vitamins and minerals and possibly hormones. Anybody out there who is menopausal may notice that there is a change in how your brain operates when estrogen and progesterone change. In fact, I've got a funny story about that one. If you want to hear a funny story, I was called to a patient's home that I hadn't seen in quite a while. And when I got there, the son, when I asked where she was, said she's out in the garden. So I got in the garden, and she dug herself a hole. She was standing in the garden, knee deep in the garden, with her hands out, with her head back, basically saying over and over, "I'm a flower, I'm a flower, I'm a flower." Now that's a type of menopausal psychosis, I guess, if you want to call it that, and there's more to that story, but it turns out that she'd gone off her thyroid medication for no particularly good reason, and was having some other problems, but that just points to the fact that hormones have a big impact on how our brains operate. So the blood values that you might pay attention to for this subtype number 2 would be anything related to blood sugar. So fasting blood sugar, hemoglobin A1C, which is how your body handles glucose over 3 months, and serum insulin, which isn't done that often but should be done more often. Serum insulin is a marker for insulin resistance and possibly a precursor to type 2 diabetes. I'm sure you're aware that type 1 diabetes, for example, is a lack of insulin, but type 2 basically is too much insulin. And insulin is an anabolic hormone, so it likes to build up things, which is why it's been linked up to certain cancers and that type of stuff. So fasting blood sugar, hemoglobin A1C, serum insulin, that's the ones that I would be looking at as possible precursors to say, gee, I could be getting type 2 Alzheimer's later on. And it's really important to also have keep your blood pressure within normal limits, your lipid levels, etc., because metabolic syndrome also has been linked up to the possibility of Alzheimer's. The third type that he's identified appears to be related to chronic exposure to environmental toxins like metals and molds, and this is probably where the aluminum idea comes, and also if people are exposed to things like mercury, for example. in this type, it often happens to younger people with no family history of Alzheimer's or dementia, and they categorize it by a certain change of MRI on or what the brain does. It actually atrophies in a particular way. Now, in general, I think Alzheimer's has brain atrophy anyway, but so Dr. Bredesen, I don't think I'm saying his name right, Bredesen has designed a protocol that he thinks will help deal with this multifactorial idea, and of course, it's attempting to reverse chronic inflammation, decrease the insulin resistance, and avoid the brain atrophy. So I just wrote down the points that he has there. Anybody who saw the previous Facebook Live, you'll see that there's some overlap here. First on his list was eating mostly a plant-based diet, especially broccoli, cauliflower, Brussels sprouts, and leafy greens like kale and spinach. Restricting and avoiding simple carbohydrates from the diet, bread, pasta, cookies, cakes, candy, and sodas, and eliminating gluten and added sugar, for we know both of those contribute to chronic inflammation. Avoid fish that might be toxic, especially with mercury, like tuna, shark, and swordfish, although I've never had either one of those last two. And he is also a proponent of intermittent fasting. He says practice at least 12 hours a day of intermittent fasting. So that means eat within a 12-hour window and fast for the other 12. So if you were eating, start at 7, you finish at 7 a.m., you start at 7 a.m., finish at 7 p.m., and then basically don't eat again until 7 a.m. Now, in the last Facebook Live, before that, doesn't really matter, most people do an 8-hour window and a 16-hour fast. But he says 12-12 works just fine, so that's okay. Optimizing your sleep patterns and getting at least 8 hours sleep at night, good luck on that, also is useful. And hydrating your body. And going back to the previous thing about sleeping, I was reading this morning, actually, that if you get 6 hours of sleep or less, you wake up in a dehydrated state. Apparently, the hormone vasopressin doesn't kick in to the last stages of sleep around that 7.5, 8 hour window. So just be aware of that. If you have a night like last night when you only get 6 hours of sleep, then maybe you need to hydrate a lot sooner and more during that particular day. He also is a fitness proponent, exercising 30 to 60 minutes, basically Monday through Friday, 5 days a week, or whatever you want to do it, meditating, doing yoga to reduce stress level, and doing brain training exercises for 30 minutes 3 times a week. And I think there's some apps for that people download. In any case, the approach of Dr. Bredesen is very naturopathic in orientation. And my take on it in the summary would be reduce the inflammation, especially the gut inflammation, take out wheat if you can, gluten, increase your antioxidant consumption through diet and antioxidant supplements to reduce oxidative stress, control your blood sugar, and just as a FYI, chromium is huge. Most of us are chromium deficient, and that's one of the things that can make a big difference. Manganese and molybdenum are also minerals that I think people, as a rule, should increase their intake of, either through the diet or through supplementation. And it's important to exercise your body and your brain, because your brain actually needs the circulation and so on. So there are 3 types, and it's kind of important that you know early on which type you might tend to develop, but the bottom line is cover them all. I mean, if you eat well and exercise, take the right supplements, reduce your stress level, you've reduced your risk of Alzheimer's anyway. But if I were you, I'd also check to make sure you don't have the gene involved in that. That would increase or up the ante quite a bit. With these Facebook Live presentations, by the way, we're going to, somewhere in the comments section, or find some other way to have you, if you'd like them I think we can capture them and embed them in an email. So if you like to do the email thing on Saturday mornings, and I promise we're not going to bombard you with things like that, once a week is enough, then we'll have a way for you to either click the link and we can get them to you then. Okay, and I'll have more of that on other Facebook Lives. And hi, Shailin, how are you? Nice to see you. I hope to see you again soon. Yeah, so I hope this has been useful. If you have any questions, you can send me an email at my office email, office@mindandbodymiracles.com. And until next time.